Hello everyone, I am Bharvi Hemant Keni from second year B.Pharm of Shivajirao S. Jondhale College of Pharmacy, Asangaon. Today, topic for my video is sedatives, hypnotics and centrally acting muscle relaxants, which is guided by Dr. Nitin C. Moire, professor and principal of our college. Sedatives and hypnotics. Sedatives are the drugs that decreases the activity, moderates the excitement and calm the recipients. It decreases the responsiveness of the stimulation and decrease motor activity. Hypnotics are the drugs that produce drowsiness and facilitate the onset and maintenance of sleep that resembles natural sleep. Sedatives and hypnotics are CNS depressant differing in time and action. Hypnotics at low dose act as sedatives, whereas hypnotics at high dose act as general anesthetic. Increasing grades of CNS depression, sedation, which turns into hypnosis, and then it turns into general anesthesia. Classification. First comes barbiturate, which is long acting, short acting, and ultra short acting. Second comes benzodiazepines, which comes hypnotics, anxiety, and anticonvulsant. Third comes newer non-benzodiazepines hypnotics. Barbiturates. Barbiturates are drugs that cause relaxation and sleepiness. A barbiturate overdose occurs when someone takes more than the normal or recommended amount of this medicine. This can be by accident on purpose. An overdose is life threatening. At very low doses, barbiturates may make you seem drunk or intoxicated. Mechanism of action MOA. The primary mechanism of action of barbiturates is inhibition of the central nervous system. It causes central nervous system depression. This is brought about by stimulating the inhibitory neurotransmitter system in brain called the gamma aminobutyric acid GABA system. Pharmacological action CNS dose dependent effect, sedation, hypnosis, general anesthesia, then comes coma. Decreases time to fall asleep and increases sleep duration. REM NREM cycle is disrupted. Respiration depresses respiratory center. CVS decreases HR and BP. Skeletal muscle anesthetic dose reduce the muscle control. Smooth muscle decrease tone and motility of bowel. Kidney decreases urine flow by decreasing BP and increases ADH release. Adverse effect. Common side effect of barbiturates includes drowsiness, headache, low blood pressure, hypotension. Serious side effects of barbiturates include abnormal slow breathing, coma, confusion, fainting, hallucinations, temporary breathing sessions. Uses used for treatment of seizure disorders, non-ental withdrawal, insomnia, preoperative anxiety, inductions of coma for increased intracranial pressure. Second comes benzodiazepines. Benzodiazepines, sometimes called benzos, are a class of psychoactive drugs whose core chemical structure is the fusion of benzene ring and a diazepine ring. Mechanism of action MOA. Benzodiazepines work by increasing the effectiveness of the endogenous chemical GABA to decrease the excitability of neurons. This reduces the communicative between neurons and therefore has a calming effect on many of the functions of the brain. Pharmacological action and uses includes sedatives, hypnotics, anti-anxiety, anticonvulsant, muscle relaxants. Adverse effect dizziness, vertigo, weakness, blurring of vision. Then the third comes newer non-benzodiazepines non-benzodiazepines hypnotics. Zopiclones act similar to BZDs but not to BZDs receptors. It doesn't alter REM sleep and prolong stage 3 and 4. It doesn't disturb sleep architecture, produce hangover. Indicated for the treatment of insomnia. Zolpidem has only hypnotic action, little suspension of REM. Sleep duration is prolonged, indicated for the treatment of insomnia. Uses hypnotics, anxiolytic, anticonvulsant, centrally acting muscle relaxants, pre-anesthetic medication. Centrally acting muscle relaxants. Centrally acting muscle relaxants and exerts its effect by inhibiting afferent nociceptive inputs to the spinal cord, annuating the spinal reflexes and inhibiting descending reticulospinal projections. The centrally acting muscle relaxants are a group of drugs that act in the central nervous system (CNS) to mitigate tension and spasms of skeletal muscle. Drugs within this group are structurally heterogeneous and act as a variety of receptors in the CNS. Classification include mefenacin conquerors, mefenacin chlorzoxazone are the examples. For the class benzodiazepines, diazepam and others are the example. GABA mimetic baclofen are the examples. Centrally alpha-2 agonist taxanidine are the example. Adverse effect includes the most common side effects includes tiredness, drowsiness or sedation effect, fatigue or weakness, dizziness, dry mouth, depression, decreased blood pressure. Uses spasmolytics are also known as centrally acting muscle relaxants are used to alleviate musculoskeletal pain and spasms and to reduce spasticity in the variety of neurological condition. For reference, you can refer this both slide share and we are thankful to our President, Honorable Dr. Shivajirao Jondhale Sir, Secretary, Honorable Dr. Geeta Khare Madam, and Principal Dr. Nitin Mohire Sir for encouragement and guidance for efficient use of social media to spread knowledge. Through making informative videos, please like and subscribe our channel for such more informative videos. Thank you.